Getting the medication and advice you need could get harder. More than 400 pharmacies have shut across the UK in the last 5 years, and more are set to close.
Is it a prescription that's...
It's blood pressure tablets.
This comes as pharmacists are being asked to do more to help take pressure off GPs and support patients like Zara.
I mean, just right now I just got some medical advice about like a little patch on my lip. And that's something, if I try to get advice from the doctors, you kind of have to wait 2 weeks for that because it's not that urgent. But also, I mean, that was great advice. Now I know I don't need to panic about it. It's not infectious. And she's already told me what I need to do and try. And if it doesn't get better, come back again.
She's not the only one, as others here in St Albans have been unable to get a GP appointment quickly enough.
It has happened. I think it was some dry skin issue. Yes, and I was able to get advice which helped from the pharmacy.
And that was after attempting to go to the GP?
Yes, it was.
Pharmacists are an essential part of the community, just like optometrists, of which I was one, and GPs, another. And more work is now handed over to pharmacists doing GPs work, I know that.
And that's why those in the industry are demanding action, as they say closures of pharmacies is adding hundreds of thousands of unnecessary GP appointments. Pharmacies up and down the country argue that while the government is putting in just over £2.5 billion into the sector every year, it's not in line with inflation. And they argue that we may see even more pharmacies have to close their doors. To survive, some are having to borrow to stay afloat as energy and medical bills have increased. Dr. Layla Handbeck says her industry is broke to their knees due to years of underfunding.
We've estimated that so far, since 2015, over 1,000 pharmacies have permanently closed their doors, and more will be doing so this year. So it's, something needs to be done about this. Otherwise, we're going to be seeing, pharmacy deserts as we're seeing dental deserts.
The Department for Health and Social Care told us £645 million of new funding is available to support the expansion of pharmacies, and that 4 in 5 people have access to one within a 20-minute walk from home. But in the most deprived areas, the concern is for how long. Theo Chikomba, GB News.